This is a debate discussing the use of punishment in applied behavioral analysis. The format of the debate will be a formal debate. I'll start by introducing the members. I'm Stephanie, and I'm the pro moderator and pro stater. Next, we have Amy. She is the con moderator and con stater. After that, we'll have Lauren, the pro prover. She will be bringing up research to support their side. After that, we have Asia, the con prover. Next is Alexa, the pro attacker. And finally, we'll have JC, the con attacker. Each member of the debate will have about 5 minutes to explain their points. At the end of the debate, the staters will discuss the points left from each side. I'll start by discussing the main points for the pro-punishment side. First, Section 2.09 of the Behavioral Analyst Compliance Code states that clients have the right to effective treatment. If the most effective treatment for a behavior is punishment, then this treatment should be offered to a client and their family. Next, Section 4.08 of the Compliance Code clearly states that punishment is permissible when necessary and lays out the specific guidelines to follow when incorporating punishment into a treatment plan. If these rules are followed, there is no reason that punishment should not be an option for a client. In addition, punishment procedures should be deemed permissible if the behavior that it is targeting is a threat to the individual being treated or others in the individual's life. In a study done in 2003 by R.M. Fox, it shows how the use of punishment was used to significantly reduce dangerous behaviors such as self-injurious behavior and aggression. Another study done by Hanley, Piazza, Fisher, and Maglieri in 2005 shows that punishment procedures in combination with functional communication training were shown to more significantly reduce extreme maladaptive behaviors than just non-contingent reinforcement and functional communication alone. The same study also showed that individuals being treated actually preferred the behavior intervention, including punishment, than the behavior intervention using functional communication and non-contingent reinforcement alone. This is in accordance with Section 4.02 of the Compliance Code, which states that the client should be allowed to be included in the change of their behavior intervention plan. Next, we'll hear from Amy, the con stater.
Hi, everyone. My name is Amy Cloran, and I am the con stater. I will be informing you on the main points that the con punishment side will be discussing throughout the debate. We will start by providing some examples of punishment that have taken place throughout history. This will include the residents of the Sunland Training Center in Miami in 1972. The con punishment side debates that punishment is not necessary in the field of ABA because it does not teach new behaviors and it can lead to negative side effects such as aggression. To back up the idea that punishment is not necessary, in the 1990s, organizations such as the Council for Exceptional Children, the American Association, and the Association for Persons with Severe Handicaps all expressed their opinions on punishment and aversive interventions, stating that less intrusive interventions can be effective without all the negative side effects that the use of punishment can cause. We will be discussing the behavior analyst's responsibility to provide effective treatments to their clients and how they have the rights regarding punishment. Kuchar and Keith Spiegel, 1998, mentioned that we should do no harm and be just, and how can we do this when we are using aversive procedures that can have lasting negative side effects? We will also relate the con punishment side to the professional and ethical codes for behavior analysts and which codes apply to punishment. Next up is Lauren, and she is the pro-punishment prover.
Hi, I'm Lauren. I'm going to be following up on Stephanie's earlier statements for the pro-punishment side of the debate. I'm going to start off by talking about the research that has demonstrated that punishment has been shown to be more effective in reinforcement in the treatment of problem behaviors. I'll go on to talk about some of the research that backs up the fact that using punishment actually reduces the risk of harm to clients, and that lastly, clients should have a right to choose what their treatment options should include, and that can and should include the option to include punishment. So first, I'm going to talk about a study from Hagopian et al. In 1998. They examined 21 research articles to look at the efficacy of punishment procedures versus reinforcement-only procedures. You can see on the chart here in the graphic, the functional communication training interventions were looked at in comparison to functional communication training with punishment. What was demonstrated was that in only 1 of 10 cases was the reinforcement-only based procedures found to be effective. In contrast, punishment procedures were found to be effective in about 90% of cases that were used. This is an extreme difference that certainly shows that based on those 21 research articles, that punishment can be very effective in its treatment. In an earlier study that also looked at functional communication training, a 1993 study by Fisher et al. Also looked at functional communication training with or without punishment, and if again found very similar results, that the procedures that included punishment were overall more effective. Not only is punishment more effective, it also can be safer for our clients. In Richard M. Fox's research in 2005, he examined clients who were exhibiting very dangerous behaviors that put them at risk of bodily harm. Those included self-injurious behaviors as well as physically aggressive ones that could result in their hospitalization. His research demonstrated that only with the use of punishment procedures were treatment options found to be effective, both in the short term and the long term. So that reduced the client's need to use medications and ultimately improved their lifestyle. To touch on the fact that our clients should be a part of their treatment decisions, there was actually a study by Hanley et al. That looked at these options. In their research, they gave clients the option participating to elect to include punishment or reinforcement only as part of their procedures. What they found, which was surprising, they thought, was that the clients actually elected to include punishment as part of their procedures. This gave them the opportunity to come in contact with reinforcement more often because, again, it was more effective. So as behavior analysts, if we want to advocate for the most effective evidence-based treatments, which we are called to do in our compliance codes, we cannot ignore the fact that when it comes to punishment procedures, there is a huge mass of research that demonstrates that it should be included in treatment. In denying those treatment options, we do them a disservice to our clients, and we also can damage their long-term opportunities to success. So we, in a way, cannot shun punishment procedures because they are not deemed socially acceptable if we know that they might be the best thing for our clients. Next, we are going to hear from Asia from the con punishment side.
Hello, my name's Asia, and I'm going to be piggybacking off of Amy's points from earlier. So it was due to the use of extreme punishment procedures towards the residents of the Sunland Training Center in Miami back in 1972 that ultimately led to the necessity of a universal compliance code, according to McAllister's article in 1972. Within punishment procedures, though, is a slippery slope. The punishments at Sunland had evolved into such extremities because of how immediately effective such consequences could be. And there eventually can arise an over-reliance on punishment, and then not only will it be too much, but it'll become more extreme, according to Martin and Pear. While the staff implementing these procedures were supposedly well-meaning in the sense that they only wanted to help these patients recover from their problematic behaviors, doing things such as restraining patients, forced seclusion without bathroom breaks, public shaming of multiple kinds, depending on the behavior that the client displayed, denial of food or sleep, the list goes on. In these scenarios, those administering the punishment did not take into consideration the feelings of those being punished, and certainly their dignity was being scrapped. Punishment procedures, even ones that are not as extreme as the ones explained here, can create certain feelings of fear and anxiety, demonstrated by crying or elopement towards the people or circumstances surrounding the punishment procedures. For example, these punishments in Sunland were so aversive that one patient even died trying to escape from the facility, which leads on into the Professional and Ethical Compliance Code for Behavior Analysts, which was created in the first place to avoid such inhumane acts towards patients from ever happening again. Code 4.08 says that reinforcement procedures should be used rather than punishment whenever possible, as reinforcement does not tend to have such negative side effects, as mentioned prior, simply due to the basics of said concepts. With reinforcement, clients receive personally favorable consequences. With punishment, clients receive personally aversive consequences. And Code 4.09 says to use the least restrictive interventions that will be effective in changing behavior. These, again, are meant to avoid such disastrous circumstances that happened back in Sunland. And another unfortunate consequence that can arise because of punishment is discussed by Durant and Ensom in 2012 from multiple studies, many of which demonstrated how punishment procedures can have the unwanted consequence of aggressive behaviors such as hitting, kicking, etc., being displayed by those who are punished towards peers and family members. Punishment procedures and reinforcement procedures can end up having similar or the same desired effect on behavior, although with one caveat towards punishment. Punishment does not teach new behaviors. It only lessens or takes away a certain behavior, according to Martin and Pear. Reinforcement, on the other hand, does teach new behavior. In studies by Capriotti, Brandt, Ricketts, Espel, and Woods in 2012, and Joette, Hurst, Dozier, and Payne in 2016, it was demonstrated that differential reinforcement was able to increase on-task behavior and reduce tics just as well as comparative punishment procedures able to, as you can see by the graph there, which it has to do with the tic suppression. Therefore, it is reasonable to assume that punishment procedures across the board have rival reinforcement procedures that can produce desired outcome for the same individual and in a more positive light. So next will be the pro-punishment attacker, Alexa.
Hi, I'm Alexa, and I'm the pro-attacker. The first point that I would like to address is that punishment is often used to equate to bad or violent. This notion is not correct. Or what many people refer to as corporal punishment does not qualify for what the behavior analysis community defines as punishment. The nature of the intervention or the techniques it uses do not make it punishment. A punishment procedure is only identified as such when we look at what happens to the behavior in question. Again, not all violence is considered punishment, and punishment is not necessarily violent. If we look at the first slide I have, we can see that the problem behavior would be feces smearing, which is in column 1. In both cases, we see that spanking is used in an effort to decrease the behavior, and we see that in column 2. The difference in these cases is that in one, the smearing increases, and in one, the smearing decreases. Many people would refer to the spanking in column 2, and that would lead them to define spanking as punishment, both being punishment procedures. But behavior analysts would only define spanking as a punishment if the behavior decreased, which could be found in column 3. If the problem behavior does not decrease after a reasonable amount of time, this intervention would not be considered punishment. If the problem behavior in this example, the smearing, increased after the intervention, then the intervention would actually be considered reinforcement, not punishment. The procedures used at Sunland are extreme examples of violence being used as punishment, but they do not define the category of punishment as a whole. From that, we can see in section 4.08 of the Professional and Ethical Compliance Code, which lays out the considerations necessary for the use of punishment. It's simply not that simple. Punishment may be unavoidable. Defining any procedure as being punishment or reinforcement is not as easy as it seems, even by researchers and clinicians. The previously referenced Rice and Kohler 2012 study describes some of the most extreme examples of punishment. However, they also describe an intervention for a client who pinched when he was anxious. In this intervention, an extinction procedure was used in conjunction with positive reinforcement. The pinching behavior actually decreased following the implementation of the extinction procedure, and the study includes extinction in the category of punishment reversives and concludes that this was actually a necessary component of that intervention. A study by Lerman and Vondran 2002 to suggest that punishment may underlie some interventions that are not typically thought of as punishment procedures. They suggest that different variations and procedures of extinction could be considered punishment. The same conclusion that was actually drawn by Rice and Kohler in the 2012 study. They also suggest that punishment is a component in the removal of reinforcing stimuli in differential reinforcement procedures, even though differential reinforcement procedures are widely accepted and not typically considered a punishment procedure. Next slide, please. Here we can see that a problem behavior such as appropriate touching could use an intervention in which the lack of inappropriate touching allows the client to earn high fives and computer time. If the client is not successful, the removal or the loss of the opportunity for the computer time could be considered punishment according to these studies. Next, I'd like to address the study by Durant and Ensom 2012 that suggested that there's a possible increase in aggressive behaviors when punishment procedures are used. The increase in aggressive behaviors seen by Durant and Ensom 2012 only examined certain punishment procedures. Punishment procedures such as response costs, reprimands, and timeouts were not examined, and they are much less intrusive versions of punishment. It would be incorrect to assume that an increase in aggressive behaviors would be seen in all punishment procedures. Punishment is not necessary. However, clients have a right to effective treatment, and we should take that into consideration. We should take into consideration that said punishment may include punishment procedures. Many of the studies discussed previously address problem behaviors such as tics and off-task behavior, neither of which put the participants in any immediate or imminent danger. However, multiple studies, including that by Lerman and Vondran 2002, Hanley, Piazza, Fisher, and Magliari 2005, emphasize the importance that self-injurious and aggressive behaviors should be decreased and eliminated quickly in order to provide the client with a safe and therapeutic environment. Next slide. Finally, I would like to address the graphs of a study that suggests that procedures devoid of punishment reduce target behaviors to levels that are comparable to levels of procedures with punishment. This would be true of this study examining tic behaviors, but another study we have previously referenced by Hanley et al. 2005 shows a different story. If we look at the slide, we can see that the level of aggressive or problematic behavior was reduced to lower rates when combined with the punishment component. You can see those circled in red. Especially when dangerous behaviors, this difference in levels could be the difference between safety and harm for the client and for those around them. When some or all punishment procedures are left out of the equation and procedures with less absolute restrictiveness are used exclusively, there is a possibility that they take so long to be effective that they end up being more restrictive overall. This concept is covered in a paper by Van Houten, Axelrod, Bailey, Favell, Fox, Iwata, and Lovas, 1988. Again, this is particularly important when the problem behaviors could harm the client himself or the people around him. Next, we'll hear from JC, who will be presenting the con attack arguments.
Hi, my name is JC, and I'm the con attacker, and I will be going over the rights of the client and the core ethical principles. So according to researchers, behavior analysts have an obligation to their clients to ensure that they are receiving the most effective treatment. Van Houten, Axelrod, Bailey, Favell, Fox, Iwata, and Lovas list 7 rights that a client has. 3 of the 7 apply to the use of punishment. So first, clients have the right to a therapeutic environment. This means that the environment should be safe, humane, and responsive to the client. Using punishment procedures could potentially be unsafe and put clients at risk of harm. Second, clients have the right to services whose overriding goal is personal welfare. So if withholding treatment or implementing treatment involves putting the client at risk, committees have to review the case to make sure that the client's welfare is being protected. So there are standards that determine if the program compromises the individual's basic rights. In addition, using punishment procedures put the client at risk, and according to research, punishment procedures may result in unwanted side effects, and this can include fear, escape, and avoidance. Third, clients have the right to the most effective treatment procedures. Procedures should only be used if they have produced effective results. Reinforcement procedures have shown to have effective results. Also, reinforcement procedures are always recommended to be used first. So in addition to the client's rights, the use of punishment goes against a few of the core ethical principles that are outlined by Bailey and Birch. So first, behavior analysts should do no harm. This means following a system regimen in which it will be beneficial for the client. The intervention should help the client and not harm them. Using punishment procedures to decrease behaviors can cause harm that is unnecessary since reinforcement procedures are shown to be successful. Second, being just. Behavior analysts should treat others how they want to be treated or how they want their child to be treated in a similar circumstance. So, do we want our loved ones to be punished when behavior change can be brought about by using reinforcements? I don't. Third, pursuit of excellence. Behavior analysts need to stay current with the developments and updates of rules and regulations, and the current research shows that reinforcement is more effective than punishment. And in response to Lauren's points, functional communication is the most commonly used intervention for individuals with intellectual disabilities who engage in problem behaviors. Functional communication exceeds the American Psychological Association's criteria for empirically supported treatment, and it is identified as a well-established treatment. Therefore, punishment is unnecessary. Also, in the 2005 follow-up study from the Hagpian, Fisher, Sullivan, Acquisto, and LeBlanc, researchers found 58 studies that compared the use of punishment procedures. So the results showed that when punishment was used in combination with other interventions, including functional communication and differential reinforcement, the results showed a less than successful rate than the 1998 study. In addition, when punishment was used with other procedures, it was less effective in the study when functional communication was used alone. And so this graph shows that using punishments with the other intervention revealed a less than successful rate. Researchers revealed that the updated examination of punishment procedures demonstrate that using interventions with functional communication are now more readily used, including non-contingent reinforcement, differential reinforcement of alternative behavior, and differential reinforcement of other behavior. And next we'll hear from Stephanie.
Now that we have heard from both sides, I will present the points that are left standing for the pro-punishment side. First, punishment when used correctly can help individuals and their families reduce otherwise extremely problematic behavior that may result in the injury of the individual or the injuries of others working with the individual. It is also important to refer to Section 4.08 of the Compliance Code when implementing a behavioral plan that includes punishment procedures. Following these guidelines can help to ensure the ethical use of punishment and to give the client the best possible treatment. Although JC mentions that in the 2013 article by Rooker, Jessel, Kurtz, and Hagopian, they find that functional communication in combination with differential reinforcement of alternative and other behaviors was more successful than punishment. Punishment was not included in as many of the studies as was functional communication. This could potentially skew the results of the study. Also, the procedures used with each study differed greatly from case to case. Thus, future research must be done to validate the reliability of this study. Individuals should be looked at on a case-by-case basis. If all other options for dangerous maladaptive behaviors have been used, punishment should be permissible to implement, thereby standing by Section 2.09 of the Compliance Code and ensuring the most effective treatment for the client. Now we'll hear from Amy with the points left over from the con punishment side.
To conclude this section of the debate, I will discuss the salvage points for the con punishment side. Throughout this debate, you can see that the use of punishment is a controversial topic in the field of applied behavior analysis. In the Behavior Analyst Certification Board Professional and Ethical Compliance Code for Behavior Analysts, Code 4.09 discusses that BCBAs should use least restrictive procedures. When it comes to restrictive procedures such as punishment, it should only be used when the results have demonstrated effects that are safe and have significant behavioral improvements. The core ethical principles taught to us by Kuchar and Keith Spiegel, 1998, questions why we should use punishment when reinforcement procedures can have the same outcome without the negative side effects that punishment can cause. Punishment lessens the likelihood of a behavior occurring in the future, but it cannot teach the appropriate behaviors that we want to occur. Code 4.08 is the considerations regarding punishment procedures. It discusses how reinforcement should always be used before punishment. The argument that punishment should be paired with reinforcers is considered in a follow-up study conducted by Rooker, Jessel, Kurtz, and Hagopian, 2013. The researchers found that when punishment procedures were paired with other interventions, such as functional communication training and differential reinforcement, it was less effective than when the functional communication training was used alone. To conclude, Section 2.09 states that clients have the right to effective treatments. Behavior analysts have obligations to their clients. These obligations include therapeutic environments, right to services whose overriding goal is personal welfare, and the client's right to the most effective treatment. Reinforcement should be used rather than punishment whenever possible. This is because reinforcement can teach new behaviors and it does not have the negative side effects that punishment can cause. Next, the staters for both the pro and con punishment side will ask questions to the opposing side. I will start by directing my question to Lauren, who is the pro-punishment prover. As behavior analysts, it is important to maintain knowledge of current scientific and professional information. This includes literature, training, and conferences. According to Code 1.08, 1.01, which is the reliance on scientific knowledge, and Code 1.03, which focuses on maintaining competence through professional development. Can you explain why the majority of research you mentioned throughout the debate is not up-to-date research about punishment?
Thank you, Amy, for the question. So a few comments on that. We do have several research articles on the pro side that are older research, but it should also be pointed out that on both sides of the debate, some research is from quite some time ago. The Sunland incident that Asia references several times is back from 1972. And we also have several articles that come from more recent research in 2005, 2013. So we do have some research that is more current. I think some other points to be made regarding that question is that the basic behavioral principles that have been established regarding functions of behavior, reinforcement versus punishment, have been longstanding in the field of ABA. These are not topics that shift in their definition or change in any significant way over time. So the relationships and the principles that were established back when research first began on these topics still holds true today. And I think lastly as well, the research that currently exists in punishment is a little less easy to come by because of some of the ethical concerns that have arisen around punishment. Some of the articles that JC mentions in her argument actually pointed out that it was more difficult for them to find research that included punishment procedures because they simply were not as frequent as reinforcement only procedures. So it can be a little bit more difficult to locate this research, not because it is not effective or up to date, but simply because it is not as common to find. So hopefully that answers your question. And I think Stephanie from the pro side has a question for the con side.
Thank you, Lauren. This question will be directed to Asia and JC on the con punishment side. Our question is, why is not using punishment important to the field of applied behavioral analysis and the interventions that are being implemented?
That is a great question, Stephanie. So applied behavior analysis uses the principles of behavior to improve socially significant behaviors and experimentation to identify variables that are responsible for behavior change. One principle of applied behavior analysis is reinforcement. It is used in behavior change, and research has demonstrated that the use of reinforcement has effective results. In addition, the Professional and Ethical Compliance Code for Behavior Analysis has a code that is dedicated to the use of punishment procedures. This is so that if punishment is necessary, it can be used ethically. However, there is no code for the use of reinforcement procedures. Asia?
Yeah, and not using punishment gives outsiders a more positive view of our field. If ABA or other behavioral science were to be highlighted in the news, it is often for some scandals like the Sunland disaster in 1972, or the inclusion of shock therapies for the sake of behavior modification, such as at the Judge Rutenberg Educational Center. The website Autistic Kids, that was last updated in April of this year, has a page of archived blogs dedicated to parents and adults with autism discussing some of their views on ABA. And some are disturbing with the punishment procedures that have been used: restraint, gluing hands down, etc. There was enough punishment or aversive procedures to create PTSD, or post-traumatic stress disorder, in an otherwise highly functioning child with autism. Regardless of punishments these days becoming less intrusive and less terrible than they were in the past, what tends to stick out in people's minds are that these stains that are left on our field's past. It's only by getting rid of punishments that people will be more willing to give us a chance. Getting rid of punishment increases acceptability, and greater acceptability means more people willing to seek out ABA for help. And now if no one has any more questions, we'll go back to Amy, our constater, to close out the debate.
Hi, everyone. This concludes our debate. We hope this has given you a better understanding of the pros and cons for the use of punishment in the field of applied behavior analysis. Thank you for watching. We hope you guys enjoyed. If you have any questions or you want to let us know your take on punishment, comment below. Thank you.